Penicillin was discovered in 1940, and 20 years after discovery of penicillin, scientists discovered that bacteria is producing an enzyme to destroy the structure of penicillin, and they called it beta lactamase because the structure of penicillin was composed of beta lactam ring. So the bacteria was producing enzyme to destroy the penicillin, so they called it beta lactamase. So we are going to talk about beta lactamase today. So first of all, you should know which group of antibiotics are beta lactam antibiotic. So I already told penicillin. Penicillin also include aminopenicillin like ampicillin, amoxicillin and piperacillin, ticarcillin. These are also penicillins. So penicillin is one class. Another is cephalosporins like first generation, second generation, third generation, fourth generation, fifth generation. Another is carbapenems, which include meropenem, imipenem, iritapenem, doripenem. Another is aztreonam, which falls under monobactam class. So these are beta lactam antibiotics, and bacteria can digest all these beta lactam antibiotics. Initially, when penicillin, ampicillin was widely used, amoxicillin was widely used, lot of bacteria developed beta lactamases to destroy those ampicillin, amoxicillin, penicillin, and like after 10 years of discovery of beta lactamases, they also marketed beta lactamase inhibitor. So beta lactamase inhibitor is combined with beta lactam antibiotic, so it inhibits the beta lactamases enzyme that is produced by the bacteria. Like they marketed ampicillin sulbactam, amoxicillin clavulanic acid. And when cephalosporins like ceftriaxone was widely used, then bacteria also learned to digest the ceftriaxone. Initially, when ampicillin, amoxicillin was widely used, ceftriaxone was not used a lot, so bacteria was still susceptible to ceftriaxone. But when ceftriaxone became widely used, then bacteria started also developing enzymes to digest ceftriaxone as well, cefepime, ceftriaxone. So when the bacteria started destroying even third generation cephalosporin, they named it extended spectrum beta lactamases, because bacteria is destroying cephalosporins as well in addition to ampicillin, amoxicillin, because third generation cephalosporin are a main backbone of antibiotic even today, right? So they called it extended spectrum beta lactamase, or we can call it wide spectrum beta lactamase. And in some bacteria, you will see that your susceptibility report, it will say that it is susceptible, ceftriaxone susceptible, but when you use that ceftriaxone, that bacteria become resistant after 1 day, 2 days. Like I am giving you one example. The real case scenario, we had one case of bloodstream infection with Citrobacter ferundi, and the report was saying it is susceptible to ceftriaxone. So can we use ceftriaxone in that case? We do not use, even if it is susceptible, because if you use it and patient is in septic shock, it will not respond. If you check next day, that susceptibility, it will become resistant. So it is called inducible resistance. So when you expose the antibiotic, when you expose the ceftriaxone, then the bacteria express the genes to destroy that ceftriaxone, that we call AMP-C beta lactamases. So AMP-C beta lactamases, you do not go with the word It just means like some bacteria express this inducible resistance genes when you expose the antibiotic. So what are such bacteria? You should know, because in this case, even if it is susceptible, you want to use it. So in addition to Citrobacter, one is Serratia, another is Acinetobacter, Providencia, Klebsiella aerogenes, Enterobacter cloacae, Citrobacter. So these are some bacteria that can express the genes to digest the ceftriaxone as well. So in this case, we directly go for carbapenems or cefepime. And one thing that you should know is that in these MPC beta lactamases producing bacteria, cefepime is still susceptible. So these MPC beta lactamases cannot digest cefepime. This is one point that is different from ESBL. ESBL can even digest cefepime, but MPC beta lactamase cannot hydrolyze cefepime. And in ESBL, I already told that ceftriaxone is hydrolyzed due to this extended spectrum beta lactamase, and in these we use carbapenem group of antibiotics. So carbapenem were also widely used. Then what happened that bacteria also learned to develop enzymes to digest the carbapenems. So whatever beta lactam we developed, even H2NAM, bacteria developed enzyme to digest those structures. So they developed the concept of beta lactamases inhibitors, and you can see today many beta lactam are combined with beta lactamase inhibitors. Piperacillin tazobactam, Meropenem vaporbactam, Ceftolazone tazobactam, Ceftazidime avibactam, H2NAM avibactam. So nowadays they are combining these with beta lactamase inhibitor, because these bacteria are developing the enzymes to digest all these structures.